just going to go through a couple slides here to kind of introduce the topic and cover specifics about skin of color that make it so unique and wonderful, and also difficult for some estheticians to deal with. So first things first, we're going to discuss basically the science of pigmentation. So that's our first little hour of our presentation today. After that, we'll have our panel discussion with both Lauren and Orica, who both have a lot of experience in the field, asking about their experience with people of color and what we can take from that for our practices. So first things first, let's define our terms. So skin of color, it means any skin tone varying from phototypes 4 through 6 and can encompass a number of ethnic backgrounds. So black skin is technically skin of any phototype because it can be anywhere from 1 all the way to 6, but it's people of African Canadian or Caribbean Canadian descent. But primarily, statistically, it tends to be types 5 and 6. Pigmentation is basically the presence of melanin that's deposited in the epidermis or dermis, which proportionally manifests in skin tone. So what you see on your face is your skin tone based on melanin deposition. So differences between skin tone. So what they found according to the research between black people and white people, and specifically black and white women, they found that more pigmentation is present in black skin. So that means you have more actual melanosomes that are deposited there and they're more singularly distributed. So like they're larger, they're more present, and there's more volume of them. In the second place, you see that there's less sensitivity to UV light. So the stratum lucidum in black skin is not as altered by sunlight exposure, meaning your external layer, when it hits sunlight, there's really no response compared to Caucasian skin initially, which is a very unique factor. What you'll see here is the black don't crack, if you will, the increased strength and resilience, which is statistically true. But the epidermis of black skin rarely shows any atrophy areas, number one. Number two, in black skin specifically, the dermis has more fiber fragments of collagen and glycoproteins, so you'll see more enduring, stronger skin in general compared to white skin. Additionally, fibroblasts are larger, more numerous, and you have more organelles of their actual cells there. So meaning, again, the actual cellular structure of black skin is stronger, more resilient, and tougher than white skin, even though there are, of course, going to be issues around what you see down here, the propensity for inflammation. So black skin also is more sensitive to inflammation, with more cells present, with more blood flow, with more stuff going on. You can imagine when you trigger an inflammatory process, it'll be more widespread, a larger chain reaction. That's what you tend to see there. So you'll also notice black skin does have more mixed apocrine, eccrine, sweat glands, and it has more blood and lymphatic vessels. So when there is inflammation, you'll have more blood flowing in and a more reactive response. If that happens, you can imagine when pigmentation happens as a response to it, you'll have more pigmentation proportionally to white skin for that exact reason. So that's the general stuff of the difference between black and white skin. So from clinical experience, this is what the research shows here. Studies show that many black patients find that their race discordant dermatology visits, so when you have someone who's not black treating you and you are black, it often leads to lack of specific knowledge of black patients, whether it's their skin, their hair, or hair care regimes, that these dermatologists fail to offer individualized treatments for their disorders. Within basically more than 70% of black patients, they prefer a black dermatologist for this reason. Now, statistically, black dermatologists are about 5% of dermatologists. So you have now 95% of dermatologists not equipped to give people the care they need, the support they need for their skin type. Whether it's from lack of experience, lack of study, or lack of education, these are the factors that are drawn out. And so it's on you as an esthetician, on you as a nurse to make that extra step, make that extra effort, especially if you're not from that background. And even if you are from the background, not to niche yourself in to one view of black skin, because it is so complex and so unique. And so the more you know, the better. Yeah. Yes. So that being said, what are the systemic issues with skin of color? So there is research done on this as well. So let's look at a couple of these facts here. The population of skin of color, meaning again, anyone from any background, not just black, but Indian, Middle Eastern, Latino, you can see some of the numbers here. They're historically underrepresented in dermatological education, research, and workforce. In addition, many of the dermatological disorders are disproportionately affecting them. They're hampered by limited treatment options, meaning in these conditions that are affecting people, my color and darker, they have less treatment options because it's not as well researched. There's not enough education on it, so the actual options to help you out are less. Right? And if you look at the numbers here, they look at statistics saying that basically more than half of all Americans belong to racial ethnic group, which is skin of color. Right? Additionally, almost 50% of dermatologists felt their training was inadequate to diagnose and treat skin of color. Almost 50% of dermatologists themselves said my training was not sufficient for this. And you have here anatomy textbooks. Read this. Only 4.5% of images represented darker skin tones in every dermatology book. That's 1 in 20 images because of a darker skin tone. in your typical anatomy textbook. So this is a systemic issue that is hard to undo.
The Skin Color Society actually created a big encyclopedia for that reason. Like all the issues that affect skin color and how they present on the skin in comparison to Caucasian skin.
Do you have a link for that one? Is there a link for that one for people to access it?
I can send you the link.
Yes, let's do that.
Yeah. Thank you.
It's amazing. Because here's the example of the effects of this. So in psoriasis, for example, you can read the stat. Even though African Americans had less psoriasis compared to whites, they had more severe involvement of their skin with greater psychological impact and impaired quality of life. This is the reality of when these systemic issues exist, how they manifest. Reduced quality of life, worse impact of a disease that should be treatable. Psoriasis is something relatively treatable. And so it's a sad thing to read something like that. More than that, we can talk about the Fitzpatrick system. So here's an interesting fact for you guys. So the Fitzpatrick system was actually developed originally for only phototypes 1 through 4. That was it. There was no type 5 and 6 at all. It was developed for white people essentially to evaluate their skin. That's what it was for. And they were later adding types 5 and 6 for individuals of Asian, Indian, African origin with brown to black complexions. So from that, the Fitzpatrick system was used by providers as a surrogate to describe race and ethnicity instead. That's a major issue. So when you see, for example, a black person come in, oh, that's type 5, type 6, immediately. When phototypes are meant to analyze how your skin responds to light, not your skin tone. That's a problem we've seen in the industry since then. Because what happens then is your treatment approach changes based on that. You might overanalyze somebody. So someone like Lucy, for example, you'll see looks maybe to you like a type 1 or type 2 if you use that system, but she probably reacts more to a 3 or even 4, right? How would you know that unless you examine that person to see who they are, how they're responding to their skin, what their experience has been? You just pigeonhole them from the first look and say, well, black type 6, black type 5, you're missing out on so much more of that person's skin. And that's the problem with dermatologists in general. They're finding this is the case. They found here Fitzpatrick's skin type did not correspond well to the constitutive or facultative skin color. So your phototype did not always match up with your skin color, plain and simple. So based on someone's skin tone, you don't guarantee that's that phototype, that's that phototype. It's how they respond to light. You can see here, race and pigmentary phototypes do not provide an accurate predictor of sun sensitivity as defined by the Fitzpatrick scale. So there you go. So just because you're of one color does not mean you respond in that way. So just by way of review, for basically the way that melanin works in your body. So from your epidermis, here, your basal layer of your epidermis, you have melanocytes, which are these almost neurological cells which have dendrites and axons and basically push stuff from just above your dermis all the way up to the higher levels of your epidermis. And what they're pushing is melanosomes. So these lysosomes full of melanin. What that does generally is it sits above the nucleus of a cell and protects it from UV radiation. The reason why is very simple. UV radiation cleaves nucleotides. So if you look at DNA, the way it's structured, you have your nucleotides on one side and the other are bound together. When UV light hits, it breaks that. And it causes it to rejig back together in sometimes in mutated ways. So your body, the way it's designed, is designed for this. Where the melanin comes in, sits above the nucleus, so when UV light comes in, it doesn't go through to the nucleus. It hits the melanin, it absorbs it, and creates heat. That's the purpose of melanin and why it works the way it does. So the darker your skin tone, naturally, you have more melanin deposit on top of this nuclei that gives the appearance of your skin tone. It's pretty straightforward, and that's how it works in general. So then in that actual cell itself, we talked about the idea of melanosomes. So from the nucleus itself, you're creating the mRNA protein that's then transcribed, it creates the protein through your RER that goes through your Golgi apparatus and then sends out the melanin through the melanosomes into your higher levels of your skin. And so that's why you have, again, that effect we talked about. Now, with regards to the synthesis of melanin, just from a chemical level, really simply, you're basically taking tyrosine, you're converting it to melanin, which is then creating a larger molecule, which is then transported out, going to your higher layers. So that process is obviously using tyrosine, which is an essential amino acid, and you have to eat it in your diet to get it. And so it's a dietary acid you'll eat, and over time that'll be converted. The 3 steps we tend to kind of focus on here are the steps of that formation of melanin, so from tyrosine to melanin through DOPA as a middle ground there, and then going to the phase of growth to polymerization, and then deposition into outer layers of the skin. So the key thing is when you want to look at the aspects of controlling melanin production, you need to think about controlling every one of these steps. Because if you say, for example, just focus on one part, what you're doing is you're letting the other ones build up regardless, because your body doesn't work like that. When you cut off one side of things, all of a sudden things are fine. Like when you take aspirin, for example, Aspirin cuts off the COX pathway, which produces inflammation. The second you stop taking it, it's back and it's in full force. That's how it works. So you're creating almost a floodgate effect when you choose to go like this and block off one portion, one portion, one portion. So using hydroquinone or using other single therapies for skin tone colors, skin tone issues, you're going to get that effect of rebound for that reason. Whereas when you go with a more complex, more synergistic, more long-term kind of treatment that's lower dosage, you're going to get that long-term suppression of that skin color problem. That's why you'll find even if you do laser, if you don't do proper home care, it's time venture to get, let's say, 2 or 3 months of no problems until it comes back again. Because you've done something where you basically fragmented and released a lot of the melanin, you consumed by macrophages, it's gone down, your tone's looking better for a bit, but it's not the end of the story. You got to make sure you're constantly working on these basic mechanisms by which your body produces melanin to keep them in control. If you're over-responding, producing too much pigment, you have to control that in some way. Because most of the time, these conditions are what we call idiopathic or genetic, meaning they're there and they're not going anywhere. So it's important to keep that in mind. There's also the presence of this one thing called the MC1R receptor. This is a receptor in the melanocyte that responds to alpha MSH and ACTH, which are the main controllers that decide how much melanin you produce. So the proportion in which these elements react on this protein decides how much melanin you're actually creating in your cells. So this is a really important step in all of our treatments. So whether it's through our brand CML or Meline, at Derma Beauty Inc, we believe it's important to have control over this protein. Because by doing so, by using, let's say, tranexamic acid, you can control the amount that it produces. So for example, if you had, let's say, a condition of melasma and you're applying tranexamic acid, blocking these steps is great. It'll actually physically hinder the amount of melanin you produce. But the rate of production being signaled into the cell does not change without affecting this receptor. And that's why basically you're turning off the switch by using the MC1R receptor as your first step, first line of defense against pigmentation. That's why, for example, in our Meline line, that's our key ingredient. It's tranexamic acid, and with CML, it's Phyllanthus umbilica extract, which also has effects on that same receptor. So you have both cases that impact of basically hindering the effect of that protein. So that being said, there's a couple ingredients you can consider when you're looking at these from a natural perspective. Tranexamic acid is definitely one that's quite effective. Glutathione and ascorbic acid, as well as arbutin, kojic acid, and niacin, all have multiple layer effects on this process. So a combination of those ingredients tends to be the best way to go about things. Versus, let's say, just a pure HQ or laser alone. Again, in combination, these things do wonderful things. But hydroquinone, as we'll look at in a bit, is probably not the best thing for skin of color in general. It is extremely irritating to skin of color, and every combination study you find of hydroquinone with anything for skin of color is a disaster. Hyperpigmentation levels are through the roof. So keep that in mind as we look forward. For your own sake, if you guys aren't fully reminded about these things, it's a really good chart to have for your own disposal, how to diagnose different types of hyperpigmentation in clinic. I don't think any of us are able to diagnose, maybe, if you're a nurse perhaps, but knowing which conditions which. So simply put, post-inflammatory hyperpigmentation is those dark spots you see in irregular spots along the face. Now, the irregular nature of it comes from the fact that inflammation itself is irregular most of the time. You don't know where it's coming from or how it happened, especially if it's like physical trauma or heat. It's never in an even, perfect pattern. So PIH generally comes off like that. So with acne, for example, post-acne you have those scars and that pigmentation, that's post-inflammatory hyperpigmentation. So wherever that inflammation was present. Versus melasma, where you get, again, those big, broad macules, which are on the face primarily, often related to pregnancy. These are much more common, like in the Middle Eastern and Indian phototypes as well. Then with regards to solar antigenes, that's more in the Caucasian populations. We find on hands and the face as well. It's liver spots, if you will. You also have ephelids, which are freckles. Now, the interesting thing with our products, because they're affecting every level of melanogenesis, you get an effect on freckles too. Welcome. And so that's the cool thing, is like you're actually healing with the top layer, plus you're affecting the production of melanin, so you're essentially getting rid of those freckles off your face. So any good treatment will actually do that and suppress that over time. If you like your freckles, I'm sorry. Additionally, with cafe au lait spots, a very unspoken of group of pigmentation. These can occur as well in the face where they're like these big patches of color. These will also be affected positively by our products or any comprehensive approach. So what is melasma then? Melasma is, in essence, for the simplest terms possible, it's hyper-responsive pigmentation. So in the presence of normal stimulus, normal UV radiation, normal life, you have this production of these dark patches along your face. The primary reason for most of it is genetic or idiopathic, but also pregnancy-related. So that could be the hormonal aspect of it. In all those cases, your goal is always going to be to find the root cause. If it's idiopathic or genetic, you're kind of in a position where it's a long-term solution. If it's hormonal, then obviously the hormones are the main target. And so referral is very much warranted in that case, while you do your part to maintain their skin tone over time. And so again, the safest remedy in general is a combination therapy of multiple ingredients rather than one strong ingredient or one strong modality, simply because the skin is going to be hypersensitive, point blank. So the more gentle you go, the better results you get. If you're too aggressive, you'll end up causing more pigmentation, more irritation, more inflammation, which we just saw is more prevalent in skin color. So you got to avoid that as much as you can. Yeah. For melasma black skin, here's a study conducted with 2,000 dermatological patients of black origin, Washington, D.C. They found it was the third most commonly cited skin disorder with pigmentary problems other than vitiligo. Of these, patients of the majority had a diagnosis of post-inflammatory hyperpigmentation followed by melasma. So in skin of color, after everything else, after we're talking any skin condition you think of, top three, number three was pigmentation issues. We're talking melasma, and PIH, and PIH much more than melasma. And skin of color, like we talked about, skin of color, especially black skin, has a propensity to be stronger, healthier, and better, but also because of that, has more blood flow and therefore more reactions to stimulus of inflammation. So that's why I have to keep that in mind. That's going to be a common thing you see and something to be aware of, that they will have a propensity to go darker when you do any treatment. So to be careful and gentle and respectful of that skin. So here's some cool stats on different populations to see the numbers in skin of color. So for example, Iranian women, they did a study of 900 of them and found melasmas there in 40% of respondents with only 10% having pregnancy. So you have about 30% non-pregnant people with melasma on their faces. In India, it's about 41% of people who lived out in the fields, right? People who were out often under UV light, up to 41%. So this thing is a reaction to sunlight in that case. Or in the case of Arab populations in Detroit, that's my people right there, they found that 15% of the sample had melasma and 60% had other pigmentation issues. So melasma is only 15%, but for us, pigmentation is everywhere. And if you ever grow up around Middle Eastern people, you'll know that everyone you talk to, every lady above 30 has some patch somewhere. It's just one of those things where it's just a very common thing to see. These are those who disclosed it, right? And then amongst Latino populations, especially in Texas, you can see here melasma was 8%, and 4% of respondents posted past occurrence of melasma. So no matter what you look at least 1 in 10 at minimum, if not up to 1 in every 2 people you see of color, will have some sort of history or someone they know very close to them who's dealt with this kind of thing. It's a lot more prevalent than you might think it is, right? So it's always fun to say, well, listen, come and get your facial, come and do whatever, but like, not address your pigmentation. We know, we've looked at the research, it has an effect on your psychology. It's affecting your life and your body. So it's important to consider. So generally, the approach to hyperpigmentation, like we mentioned, you want to go gentle, multiple ingredients, and be considering the entire pathway of the deposition of melanin, and not just give them whatever and go harsh. So, I'll talk a bit about PIH. So post-inflammatory hyperpigmentation is much more common in darker phototypes like we talked about, whether it's 4 through 6. And so basically, you're going to see an area of hyperpigmentation wherever inflammation was induced. There's a couple cases we can talk about actually from our work, where we've seen some cases where honestly you can see the thumbprints of the hand of the actual esthetician where they created PIH. It's crazy, because they're just applying either too hard or too harsh, massaging their product, they shouldn't massage the way they do, and you can literally see the thumbprints on that person's face. So again, black skin is sensitive, colored skin is sensitive. Be careful as you apply it. And so that pigmentation always results in injury or inflammation for whatever reason. Now, I've heard it said, and I'll say this to you guys, it's important when you're going through any treatment for pigmentation to avoid irritants, even if it means not sticking your face in front of the oven when you're cooking. That heat can induce damage. Things as simple as that. When you take a bath or a shower, don't go super hot with the water. Be careful in every case. Wear your sunscreen every day. Be careful with blue light. If you're on your phone every day, you just had a melasma treatment, put on your filter, because blue light penetrates deeper than UV light. Right? It can create that same effect. So you have to be really careful, all these things, to be as diligent as possible, because oftentimes your clients will have bad results and won't be your fault. It'll be theirs. But good luck telling somebody it's their fault. Right? Good luck with that one. So it's never their fault. The client's always right, right? And so again, this is also true with yeah. I can tell you some stories now. People like putting butter on their face for moisturizing and blaming. Yeah. Anyways, yeah. And also there's like with energy-based treatments, you have to be careful which ones you use and the wavelength you use to get the best results. So keep that in mind as well, because that can have a major effect. So just using any old laser is not the best approach for skin of color. You have to really tailor it for that. So here's some stats again. To say epidemiological studies show that scrummies, including post-inflammatory pigmentation, are among the most common reasons why darker and racial ethnic groups seek the care of dermatologists. So if you're looking as to why people go to dermatologists, that's a big one right there. More frequently, it affects skin of color patients, including African Americans, Hispanics, Latinos, Asians, Native Americans, Pacific Islanders, and those of Middle Eastern descent. And PIH, here you go, can have a significant psychosocial impact on skin of color patients. So phototypes 4 through 6, as these pigmentary changes can occur with greater frequency and severity in populations and oftentimes more obvious in darker skin. And that's the kicker right there. It tends to be much more obvious in darker skin. The Caucasian person who has discolorations doesn't really show much compared to somebody who is, let's say, the type 5 or type 6, who has that kind of reactivity to sunlight and has those dark spots. It can affect their psyche a lot. And so you guys have seen this, I'm sure, with each one of you in practice. It is a reality of life. It's hard to deal with. And here you go. In a prospective cohort study of the prevalence of pigmentary disorders and their impact on the quality of life, 47.3% of patients admitted being self-conscious about their skin to some degree. 22% thought others focused on their skin. 33% reported feeling unattractive because of their skin. 33% put effort into hiding pigment changes. And 24% thought their skin affected their activities. This is sad to read. Almost a third of people here. And again, these aren't always the one group they're looking at. It's different parts of the same group that respond to each of these questions differently. So there's some to whom it's like, I'm self-conscious about how I look. Some are saying I feel ugly because of my skin. Some are trying to hide their skin changes. And some of them think it affects their day-to-day life. And people are watching it, right? That's a hard way to live. It's a hard experience. And so this is why we want to really think about this, because it says particularly here, disfiguring facial lesions can cause decreased social functioning, lower productivity at work, and reduce self-esteem. We're trying to avoid this all at all costs. So as much as you can do to really support the people you're talking to, beyond just really applying products, but really being there to talk to them, to hear them out, and support them through these conditions, and ask them questions like this: how is this condition affecting your self-esteem? It takes about 5 seconds to do, but it changes the world for them. I'll share a study with you guys that's not in the slides about medical doctors specifically. Their research studies show how much a medical doctor's engagement with a client affected results. They found one personal question improved results by 20% of all conditions. It's medical doctors. So we're not talking about like random psychological self-report things. We're talking actual medical results. Were improved by 20% just by asking one personal question. How was your day? How'd you go to work today? Imagine how much more you can do with this time of discussing with your clients what's going on, their buy-in to the treatments and the results they're expecting, their emotional response to that as well. It's really important and worth your consideration. So with melanin production, melanin, as we mentioned, is a response generally to UV exposure, affected by keratinocytes and signaled by melanocytes. So it can also be due to poor cell function, and also due to a number of different reasons, including inflammation. And melanin is again produced by the melanocytes and the keratinocyte. It's all recapped from earlier just now. So with UV light, we talked about this before, UV light does penetrate the epidermis. It can go even deeper in the case of, as we'll see here, with blue light as well. So blue light actually is deeper than UV rays. It has less energy, yes, than sunlight, but it can do long-term damage over time. Now, call me crazy, but we all have these things in our hands on a regular basis, right? And I can't tell you, from my experience as a naturopath, the amount of people who go to bed staring at their cell phone and have terrible sleep for it too. Keep in mind that it's not a good thing to be stimulated before bed, but also not a good thing to stimulate your face with constant blue light in the dark room on your face. You're most sensitive to UV exposure and blue light. So that's something worth considering. So your sunscreen as well should reflect that. But the sunscreen is, as much as you can, as broad spectrum as possible to prevent those kind of issues. Now, with sunscreen and skin color, it's an interesting fact here that you'll notice. So sunscreen itself has a couple different factors to it. So you'll say, yes, darker people don't need as much SPF protection. That is correct. With regards to blue light and regards to visible light, you'll see it's a very big difference. It's the opposite way around. So for skin of color, you need a much stronger protection against visible light. So in either case, higher SPF is better for you because it's more, especially if it's more broad spectrum. So for skin of color, broad spectrum SPF. That's all I'm going to tell you right now. So keep that in mind when you look at your clients. It's an important thing to consider. With regards to chemical peels basically are always an option, but they have to be done correctly, is what I'll say, with regards to skin color. Their function is to reset normal function of the epidermis and dermis, restore structure, function, and the appearance of the epidermis. That being said, you'll often have a good reset of color after a peel. But if it's too harsh, you'll get DIH right away. And even if it's the right peel at the right concentration without home care, you're basically just resetting for a couple months. That's it. At best. In the very best case. Because they'll go out there again, they'll see sunlight, they'll be exposed to UV rays, and within a couple of months, they'll be back in full-fledged. So it's really important to understand that peel is the first step, but not the last step. Home care is crucial. The same with lasers, with any other modality. You start there and move forward with a full plan, a treatment plan. If they come and say, yeah, I just want to do one session, I'm good, I'll be fine after that, I'll come every couple of months, get another session done, that's not the right approach. You're going to create constant rebound effects, and their body will become basically constantly going back and forth and back and forth and back and forth. You don't want that for them. You want them to have a long-term solution. And so with that being said, for any abrasive procedure, whether it's microneedling, dermabrasion, whatever it is, you have to understand you lose transdermal water, and hydration is a huge portion of this discussion too. Dry skin goes through hell, especially with pigmentation issues. It's worse. It's just worse to have drier skin. With water loss, after a peel, you have to make sure your skin stays moisturized. And for any procedure which causes inflammation, that includes lasers, includes anything else you apply to your face and it creates inflammation. At the end of the day, you have to make sure you're managing scarring, infection, and PIHs possibilities in all these cases. So let's have a look at laser as well here, just to give you a couple perspectives here on why you have to be careful with the laser you pick too. If you went, let's say, for example, ER, YAG laser, research shows here up to 40% of patients had hyperpigmentation. This is called a gentle laser. According to most of their producers, they'll call it a gentle laser. At up to 40% of cases, you have hyperpigmentation. And hypopigmentation in 14% of cases. If you don't have the right practitioner with the right product, it's a disaster. So the problem is, this is from the early days of those kind of lasers. But even with, for example, the ND-YAG lasers, so the newer ones, like even like the Airlays Neo Elite, it does a great job, but it also does generate heat in those areas where melanin is present. So it's important, as you do that treatment, to give something else to support it, to make sure you're producing heat and inflammation right where that pigment is. So what do you expect to happen? Your body will naturally produce more and more pigment. So you have to make sure to balance that and do both together. A good laser with a good peel or a good home care product together at the same time. Otherwise, it's a disaster. You can testify, yes?
Yes, and in between, so my process is I do the laser first, with especially with melasma.
Yes.
And then because the heat simulates melasma, I cool it down
That's right.
for a few minutes, like 15 minutes, and then I put
Good call.
in the same version.
Yeah. It's a bit aggressive.
Because the Airlays doesn't have it, so I'm able to do that as long as there's like a cooling down time, like
Yes.
15-20 minutes in between.
Yeah. Because it's NDI, right?
Yeah.
Yes, okay. Exactly. So it makes sense. Which if you go with ER or another type of laser, it's a whole different ballgame. So you have to be sure it's the right laser, the right treatment for the right condition. So specifically that one, around, you'd say around like a 1064. There we go. So yeah, on the same page. So just keep that in mind always. You have to be very careful with no matter if you have the best treatment plan, because the sales rep will always tell you exactly what you want to hear. You have to be able to consider both sides of things. Like we're here to tell you as well, from our side as a company, we're presenting the facts. We're not telling you to buy our product and use it willy-nilly. Use it as is best for your clients. Individualized care. Be careful and choose what you have in your office. The best modalities for them. We're not saying don't cross-promote, but be smart about it, right? That's the goal. And so, even with that, the most complicating concern is about skin darkening. So we can see with chemical peels, even you have about 2% of the time. With a normal chemical peel, you have hyperpigmentation in prototypes 3 through 6. This is probably way more than that, to be honest with you. Because most of the time, with proper home care, that goes away on its own. So most people won't report that. What would you guess, Laurie?
It depends on, I guess, the prototype again, but I see a lot of pigmentation if it's not done correctly.
Yeah.
And it can be like in prototypes 4, 5, and 6. 6 a lot.
Yeah.
A lot.
That's what
But yeah, the home care is important. If you're not going to do the home care, then I usually tell them, don't bother.
Yeah, exactly. Yeah, 'cause you're not actually following up on what you started, right?
Yeah.
That's just it's disrespectful to you. And so again, the whole entire conclusion here is, like I said, the chemical peel is usually not enough on its own. You need the home care because a chemical peel, let's say TCA or a Gessner, that especially is nowhere near enough, even on its own. Because again, that peel does not control anything of the processes that produce pigment. There's nothing to reverse UV damage. There's nothing whatsoever other than just peel off a layer of skin. So if that's what you want to do, it's probably not the best option for most of your clients with pigmentation issues. You need to have something that's more complex. So even with our products from our brands, they are peeled, yes, that's part of the discussion, but even from the moment you put it on, you're depigmenting from that point. You're anti-inflammatory from that point. You're also controlling oxidation from that point because you don't want to even start a peel without controlling for those things. It's an example like you mentioned. You put on laser, you cool. You do a peel, you control inflammation, you control oxidation. That's the goal.
But we need balance, right?
Exactly. Yeah, because again, modalities are great when you use them correctly with balance. That's again another thing to keep in mind. If you're doing peels, winter time is the time to do them. Like now is a good time to get going, where UV exposure should be avoided. But keeping in mind, people don't think about this. If they do, then they know. Snow is a horrible thing when it comes to UV exposure because it bounces off all the light back into your face. So be careful around that. And even this day like today, where it's bright and beautiful in Toronto, that's a very high UV index there. So the skin should always be kept cool, like you mentioned. After any treatment, whether it's a peel, a laser, whatever it is, will cause inflammation, cool the skin down at all costs. And if you can, try to prime it before application. Something to consider as well is priming. So when you apply a peel of any kind, or apply any kind of product that does depigment, you want to make sure to get the skin used to it beforehand. So applying it, again, even a couple of weeks, even a month beforehand, getting used to the ingredients, getting used to the response to expect. If you just jump into a peel with a bunch of ingredients they've never had before in their lives, you're playing a roll of dice at one time. And the research bears this out, that when you do a chemical peel with a pre-peel beforehand, it enhances skin peel's effectiveness, gives a shorter downtime, reduces the rate of skin darkening in higher phototypes, improves post-peel compliance because they've already started the home care beforehand. They pick it up afterwards, it's no big deal. Which if they do a peel, I came for the $100 peel, how dare you give me home care, right? It's a different logic, and we've all heard that one. So. And so for your sell-through as well as a client, it's a smart thing to do to start them on the home care as a condition of getting a peel. Make sure they're on it, you get effective results, and you can sell the package that way. And so priming it essentially is a triple ingredient approach generally. You want to use depigmenting agent, you want to use an anti-inflammatory agent, you want to use retinols as well to get the best results in those cases. That's what we do with our products and our philosophy as well. And so the history of priming generally is just a combination of retinols, and we suggest TXA and Orica as well. So nutrition, this is where I have fun. I'm going to say a lot of nutrition it's super important to understand it when you look at skin color, especially, and skin altogether. These simple changes made in your diet can make a huge impact on the results you get. So if you guys ever want to, white label supplements, it's a good approach. Omega-3 fatty acids and omega-6 fatty acids are an important balance to keep in your skin. So the more omega-6s, the more fried foods you consume, versus more healthy fats like fish oils, you create an imbalance in the way your actual oils produce on your skin surface. So for example, a weird thing to think about, if you have dry earwax, for example, flaky earwax, if you take fish oil every day for a month, it will change completely. Because the actual oil you produce in your body that's turned into waxes and whatever it is in your body that you produce, it changes with that. So for example, trying something like a borage oil, evening primrose oil, or gamma linoleic acid, those things when consumed internally for a period of time can actually reverse the way your skin looks almost instantly. So like evening primrose oil, for example, if you want a fun experiment to try, I'm not prescribing it, I'm suggesting it as an idea. It's about 4,000 grams, 4 grams of evening primrose oil for about a week. And you'll notice your skin will flip. Like any dryness you had and whatever you had, you basically turn around. So if you glow more, you have a more of a natural look. What evening primrose oil does is it is basically giving you a ton of gamma linoleic acid, but it also gives you phytoestrogens, which control hormonal balance. And over the course of about 3 months, they find, according to research, it actually can reverse any sort of dysmenorrhea, any sort of PMS symptoms that are very severe. It's a really cool option to have in your arsenal as an esthetician, as a nurse, when you're looking at people who are coming in for long-term solutions for their skin. So worth considering.
So it's 4,000
4 grams. 4 grams.
4
Okay. Yeah. So let's put it that way. Yeah, 4 grams. So 4 little pills. Yeah. It's an interesting thing to try out because I've seen a lot of patients in my experience who have very dry, inflamed skin. Just by switching that up, it creates a different type of sebum they produce. That's a huge thing for people. And so if that's generally on their skin, it's thinner, it's cleaner, it's more glowy. It's a great way to start them off on a peel as well. So, addition sugar consumption. This is a big one. Right? This is probably my biggest enemy as a naturopath and my biggest friend as a person. So, sugar is a beautiful thing, let's be honest. It's delicious, makes you feel good, and I don't know why I'm saying this right now. But consumption of refined sugars is generally a bad thing. Okay, it's a bad thing when it comes to your skin, the health of your body in general. Sugars, specifically simple sugars, they're actually really bad in terms of inflammation of your skin. So before peeling or any sort of chemical procedure on your skin, try to be careful and avoid sugar as much as you can. And tell your clients the same thing, like don't go eat Halloween candy before procedure. Not a great idea. Because even that small change in that moment can affect the results dramatically. Especially in skin of color, we're talking about inflammation as a big issue. Let's try to keep that down as much as possible. Additionally, we're going to look at hydration. Again, the thing everybody likes to talk about, but no one does well, is drinking enough water. So, according to Health Canada, it's 2.5 liters to 3.5 liters per day for a woman, regardless of your height and weight. So even the shortest woman out there, 5'0", 85 pounds, it's still 2.5 liters minimum. Hi. And the tallest, the biggest as well, it's 3.5 liters. It's in that range. For men as well, it's about 3.5 to 4.5 liters per day of water. That's for general health. That's not even to get you the full optimal capacity. But for general health, it's at least 2.5 liters per day. What we recommend generally is before a peel, about a week before, every day, make sure you hit 3 liters. It'll give you amazing results. Because remember, a lot of the ingredients in your chemical peels or your applications are water soluble. The more water is in your skin, the better the effect, the deeper the effect, the less irritating your peel will become. So you get a better, more effective peel, less inflammation and less irritation if you just drink water for a week before. So keep that in mind as well. It's a really easy option. It's super safe and way cheaper than anything else. So. We are now going to start our panel discussion, kind of going through a couple different things. First and foremost, let's introduce our 2 panelists. So, Ms. Sharpe, I'll start with you. Who are you? What's your deal?
My name is Sharpe. I've been a medical esthetician for quite some time now, but I've been working in sales. I started with Derma Beauty about 3 years ago, maybe a little bit over that, and to be honest, I've never seen any products that work this well with ethnic functioning skin. It's been really interesting to see the different results that we're getting, and especially working with somebody like Orica. My mind has been blown, to be honest, because being a medical esthetician for years, honestly, we would have to turn people away because we didn't have the right products, and it's really unfortunate. So I'm glad I found somebody in the company that can help, and we're still developing, we're still working through everything, but having a partner like Orica help us understand, and it's amazing.
And Ms. Orica Smart, how about you?
I'm Orica. I'm a medical esthetician. Under 10 years. I love it. I started on my own, I think 4 years now, just before the pandemic. Still call my business a pandemic baby. So my clients are predominantly Black and brown. So for me, it makes sense partnering with a company that not only produces results, but also in a way where it doesn't affect your skin barrier after. It's healthy for the skin barrier, and that's what I love about Senile and Milan, especially Senile. It just leaves the skin feeling so hydrated after. There's no irritation, there's no adverse effect, and that's what I love about it. Toronto it's huge, but we're all in aesthetics, so we know that there aren't many places out there for skin of color, especially darker skin tone, brown and Black men and women to just walk into and get the treatment that they need for their skin. So that's why I decided to niche. Everybody comes here. Everybody comes here, but the devices I get, like aerolays and our chemical peels, and even the products that we use, we make sure that the bottom line is hydration, 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 and really strengthening their skin barrier, because God knows, you know, we love certain things and we don't know much about, we're still in the young phase and learning phases of taking care of our skin. Mm-hmm. So most of the clients that come in are always dehydrated. So not knowing that, I love Derma Beauty for that their products are really entrenched in hydration and barrier protection.
Mm-hmm.
Absolutely.
And information, to be honest. That's the biggest thing that I've found.
Ingredient that I can pronounce.
Amblica?
Amblica, those other ones.
Tranexamic acid?
Not tranexamic, another word for Amblica.
Oh, the phyllanthus. Yeah. I can't say it either. That's why I can't say it either. That's why I just say Amblica.
Yes.
So that's it.
Yes.
I should read it.
How much are you paying again, Laura? All right. So that being said, let's jump into some of the questions for you guys. So we're going to do a couple different categories. So first and foremost, your clinical experience. We're going to ask you that. So what is your experience in treating skin of color? We'll start with you, Lauren.
Again, so to be honest, when I was a medical esthetician, there was a lot of mistrust. I didn't get very many people of color coming into me because, I'm white. And a lot of people, don't understand it. Like we were saying before, medical estheticians, we weren't taught that in school, which is really unfortunate. And you and I were talking about that. Even like dermatologists, I've heard of people just turning people away skin color. And it's really frustrating, 100% guaranteed. So to be honest, when I started working with this company, I could start working with ethnic skin a lot more, and I've learned so much. And there's still so much to learn, to be honest. Like even the cell size. When people have allergic reactions that are 4, 5, and 6, they produce more histamines. So because their cell size is bigger. So that what that means is they have even a larger allergic reaction. So it's just things like that, like picking up, and so learned a lot already. But there's still so much to learn.
You're so right about. There are two things that Black women specifically are, we're very particular about our hair, who touches it, and our skin. So when I first started, as I said, I didn't niche by choice. I went out there like everybody else. I just want to do skin. And when I was here in Durham, it's like, oh my God, I've been waiting for you all my life. Like, I've never had a facial before because I feel like nobody else understands my skin. And I'm so happy that you're in this space type thing. And I'm like, but there are a lot of Black estheticians out there, but they don't know. And even how we advertise our practices as well. We may do everybody, but then based on the pictures that you have on your site and your Instagram pages, and even the way you describe your treatments, we're not gonna go because it's not speaking to them and their issues. So I find it was a lot of that when I started. And to be honest, I also wasn't 100% comfortable in doing certain things when it comes to skin of color because, as Lauren said, we weren't taught in school that we have a big Maladi book with a beautiful Black woman on the cover, but there isn't anything in there about us describing how our skin is. Nothing about Asian skin, nothing about brown skin, nothing about Latino skin, nothing about Black skin, or it's just pretty much skin type 1, 2, 3. And when they taught chemical peels, it's like it fear the Black skin because inflammation and this and hyperpigmentation. So it's like, whoa, all of that's happening, so I'm not gonna do it.
Mm-hmm.
So that's how it was. So I had to seek external education to learn about my skin. It's kind of crazy and how it operates, and that's how I became comfortable in even now using different modalities together and feeling comfortable using laser and peeling one side because we were taught you can't do that.
Mm-hmm.
This one young lady called last summer and she's like, I've been watching your page and I'm currently in school and I noticed that you combine treatments, but we were taught not to. I'm like, homie, when you're finished school, just come on over and I'll teach you some stuff because you don't learn in school. The learning actually starts when we leave. And when we are touching the skin, seeing different types of skin, because you also can't treat Caucasian skin the same as everybody else, because even within that, you have your Scottish, Irish, and then you have like your Italians really dark and Mediterranean. So even within that, you still have to adjust to suit each person.
Yeah.
So yeah.
That's to be honest, like the biggest thing that helps me is doing a client intake. I ask all the questions, even where their background, their their ethnicity, to find out because they may look white like me, but like I have Spanish in my blood, so I PIH from stuff a lot easier. You wouldn't think that,
Right.
to be honest. So you have to dive in deep and you have to ask as many questions as possible. It may be a little bit lengthy, but at that time, say if you're going for a chemical treatment, that's what they want to do, you can also test the product on their skin, right? By doing a test behind the ear or behind the back of the knee to see if they're going to react. And I found that's the best way to do it, honestly. And you can see.
Consultation is really important.
Yeah.
It's really, really important. Finding out who people are, what they do, how they eat, what they're using.
Alcohol consumption.
Especially within the African, Caribbean, and brown culture. We have our things that are near and dear to us that I call the heritage skincare. And it's the amla oils, it's all the oils, actually. It's the homemade ingredients, and those are near and dear to us because that's what our ancestors used, right? And we don't really trust the over-counter stuff because they have a lot of chemicals in there. So it's a lot of education and educating us on how products really work and what's good for their skin, because we're used to what we're used to. We're going to use the baking soda, and we're going to use the limes and the lemons and and the bar soaps, because that's what our grandparents and great grandparents used. So that's why. And then the misconception of because of our melanin, we also feel like we can get away with a lot more because the melanin is there to protect us. We don't need anything else. So you hear a lot of, I just wash my face with water and that's all I need because I have melanin in my skin and black don't crack and brown don't frown and Asian don't raisin and all the other stuff.
We need one of those too. I really
I know,
yeah. Not yet, we don't. Okay, so that being said, guys, what are unique challenges you find face people of color in their pursuit of better skincare?
It's the inclusivity and the education on both parts, on our part and their part.
Yeah.
Yeah.
100%. Yeah, for sure. And
would you guys agree?
Like, if I can add, even like makeup, for example, like foundation. I remember like when I was in high school, I'd go shop to Shoppers, and they only had like, I don't know, skin type 1 to 4, or like for skin types 5 to 4 to 6. I think the darkest shade would be like, I don't know, it would be like really dark, and then I put it on myself and I look orange. That's how I went to Family Events for the longest time.
Right.
But then now there's like Fenty and so many different lines.
Yeah.
Inclusive of everyone, so what's crazy.
Yeah.
Changes we see now.
Not too
so
orange or
amazing.
red or you're too light.
Yeah.
Yeah, that's
Same thing with the sunscreen.
Oh yeah, that's
It's pretty much the same thing with the sunscreen, and that's why we're afraid of sunscreen because of that Casperish look or that purplish tint. Because so we'll try to stay away from it. Plus all the other excuses. Plus we were taught that we didn't need it. So there's like a lot of education when it comes to skin of color and seeking treatment, and them feeling like nobody understands what's going on with them.
All right. So what piece of advice would you give to aspiring estheticians regarding skin of color?
I would say have a mentor is the biggest thing for me. I've learned a lot, again, from Orica and from, certain friends that I have that are in the industry. So mentorship is important, I think, to be honest.
Mentorship is important, yeah, and not being afraid that there are differences, but we also share a lot of similarities in the way our skin functions, and as Lauren says, mentorship and education. Just seek external. I know in Canada, this is why this is important to me. This today, setting the tone is important to me because when I was looking for education on skin of color, I couldn't find anything. During the downtime of the pandemic, I looked everywhere online in Canada. There was nothing available, not even on the Board of Aesthetics, nothing. A bunch of dermaplaning and lashes and
Lashes.
and I had to, where I got my education was from the UK, and Dermascope in the US. They have a lot, and all the product lines that offered also included a little segment of skin of color and how they tested their products on skin of color. And that's how I have like 15, almost 20 certificates from during the pandemic from just learning and soaking up. And the dermatologists across the border and in the UK, they're also willing to include estheticians on those and nurses on those webinars. So I really love that, and that's how I got my education literally during the pandemic. So just, it may not be in Canada, but it's somewhere else out there, and that's what we're trying to do here, which is offer that here. So we don't have to always go across the pond for something.
Yeah.
Exactly. So what would you say if they told you, I want to treat skin of color, Orica? What would you give them as advice? Well, I want to be a clinician who focuses primarily on skin of color.
Focus on skin of color. Again, get your education. Turn off our biases on how skin works, and understand that, cultural, also take into consideration the cultural aspects, our beliefs and the things that we hold near and dear to us. And there are some practices that we also involve in. You kind of have to not be judgmental when it comes to those things, because in the skin color too, we have shadism, we have the bleaching that happens, and all of that. So when they come to just ask a lot of questions, it may seem like you're being nosy, but you really, really, really have to ask all the questions, all the hard questions. Sometimes they won't be honest, but you have to know the signs to see what they're doing, and then you gradually have your leading questions to, hey, so I noticed this and this, and what's happening, or what are you using? What are the ingredients in that product that you are using? And you'll see the facial expressions and all of that change, and then you're just bleaching, and all of that. So. And also understand the psychology behind bleaching, like, colonialism and all of that. So just being gentle and loving and understanding, taking off our blinders and our biases.
Absolutely. All right, next question. What is the role of traditional or folk medicine in dermatology medical aesthetics, and specifically with skin color?
Folk medicine. I'm like, is
Folk
that
medicine
like,
sounds
I would just say that.
old.
like
Okay,
the
so I'll give you-
old school. Like,
I'll give you an
remedies?
example.
Is
I'll
that
give
what
you-
you're talking about?
Yeah, so for example, let's say throw shea butter on everything, or black seed oil, or black anything oil. Anything that says black on it, put it on your skin, right? Like, because
Yeah.
when I used to work like in like a Healthy Planet, every time I walk in, every black patient would come in and they say, "Listen, I want something that has black on it. If it says black soap, I'm buying it. If it says black seed oil, I'm buying it. If it's black hemp, that's fine, I'm buying that.
Yeah, yeah.
Black maca, done." It was just one of those things where it's like the marketing was so severe. Like if it even mentions you, buy it. So people are buying all these things that might even be best for them because they're told from somebody else or from someone in their culture, just do this and do that.
That's what we need to change, right?
Right. That's what we were. The Blackism Association. So for the longest while, the reason why that is, it's because the cosmetic world really was not geared towards
Yes.
people of color.
Mm.
So products also weren't tested on us either. So there's that thing where we want something that, that was made specifically for us, because when we feel something, we feel safer for something that we feel was made specifically for us because it's going to work. I think that's what that is. But at the same time, all the black soaps, those are also not healthy for the skin because they dry them out. When they're in their natural state like that, I think we also feel that anything that is natural, it's safe, and that's also unsafe.
Yep.
Because when it's not, you just get it and you put it together. You don't know how it was made, what the environment that it was made in, is it safe, is it sanitary, and then you also, anything that's just not like refined or broken down, that could be dangerous because it causes inflammation. There are a lot of pictures online of people who've been burnt with black soap, severely burnt, leaving hyperpigmentation, and even turmeric. I had a client who literally burnt her skin with turmeric, raw turmeric on her face, on her skin. So it's dangerous. Thinking that because something is in its natural state, that means it's 100% safe for my skin, and that's what I'm going to use. But they don't understand. Even the oils, the molecules are too large. It's not doing anything. There's no nutrients. It's just sitting on top of your face, just blocking the dust. Yeah. That's all it's doing. Yeah. It's not doing Vaseline, right? Right. It's not nourishing your skin. It's not hydrating your skin. What are you sealing in when you slug? If you're not using your moisturizers and your serums, you're not
bacteria.
You're not sealing anything.
I have a question. So can you list like the top 3 or the top 5 oils that are just slugging my skin?
Well, coconut oil, the molecule is too big to penetrate the skin.
And coconut oil is also drying.
Yeah, castor oil.
That's linoleum, castor oil.
Castor oil is rough. But they're great for hair, though. These things are great for
butter,
hair.
I know, I use
shea butter. They're all just too. They just sit on top of the skin. They make the skin feel good.
There's a need for protection.
There's a need for protection. Are you speaking about like the skin on our face, or you're also referring to the skin on our body as well?
The skin on it depends on the skin. Also, the skin on your body. The skin on your body operates the same way. You can. I always tell people, if you have extra serums lying around, then you have, a lot of us have, especially during the winter time, you dry out even more. Use your serum on your body as well, and then you moisturize, and then you can re-love your oil, so you can put your oils on top of it.
Layer.
If you want to, you can layer all you want. Yeah.
So then, follow-up question for Orica. So when someone comes in to see you, they've got a whole regimen, and half of it is, let's say, folk medicine. My auntie told me this, my uncle told me that. They're on all these things. How quick are you to take them off of that?
Listen,
I'm asking you that
I
question.
kid you not. I had a consultation once, and she brought her bag.
Oh.
Bag, and she laid it out on the bed, and she had a cleanser, and everything else was oil based. Everything else was oil based. The moisturizer was oil. The serums, all the serums was oil. And I was like, she walked up with nothing. I dumped them all, and like, here, this is what you're using. And she was so surprised that I didn't give her like a 12-10 step. It was literally like 4 things that she needed, and I'm like, that must have been frustrating. Bag of things that weren't working.
Yeah.
And she was like, then, but why is my skin dehydrated? Because I have a bunch of oils. And what we don't understand is black skin doesn't really have a problem with producing oils. We have a problem retaining moisture in our skin because we don't naturally pull the hydration from the atmosphere. So when we shower, black, brown, Asians, we have to moisturize our skin.
That's right.
Or else we're just going to look like we were playing in flour for the day. Like our skin is ashy. And so hydration is our issue, is black skin, Asian skin, brown skin's issue, not a oily situation. So adding oils to it, it's cool if you're putting moisturizer on first. Then you're sealing with the oil if you want to use oil. But oil first, you're not doing anything.
So on that note, would you say that we've progressed beyond, let's say, natural or historical traditional medicine to the point where we should only go towards the scientific-based protocols? Or would you say there's a role for integration, but it has to be, like you mentioned, carefully put together in a way that is best for the client?
There's definitely room for integration and marrying both. With how I work here, I understand people love certain things, so I just teach them how to use things properly, and I always give them what they need, and I'm like, well, you can use this, but like I said, make sure you're using this in a certain way. I give them the steps on how to use their products before they go in and throw in the oils on top. Or you love black soap. I don't know what you do at home. I can tell you whatever, but at the end of the day, they're not listening. Yeah. They're gonna go home and do what they want. I'm like, but I have really oily skin, so I'm like, okay, if you love black soap that much, then maybe use it 2 times a week. Yeah. 2 times a week, then you're not overly drying out your skin, and make sure you keep it hydrated. So that's how I do it.
Absolutely.
Like I use black soap, but my thing was alcohol skin. So when you talk about the drying, I wanted my skin to be dry. And I've learned. I'm not as but I've learned. But that was the whole concept, and I've learned to like my oils because once you have a good, the oil is actually a nice oil. But originally it was just like, with not the right skin, it's heavy, it's like yuck. So black soap, man, double wash with black soap, you dry, you come on your face, it's cracking, you're like, yes, this will hold me up for an hour.
Should we cut that from the video? Or
So that was, I'm just saying that was again, without the way of the education, right?
And that is a lot of people's mentality, and
that was it.
That's a lot of our mentality, not even just like as a black person, but also Caucasian as well. Like, my skin is oily, and we use all the salicylic acids, all the glycolic acids in all the steps, and then you're wondering, why is my skin so oily? Because you're using all of that. Your skin is saying, hey, you need more. So, and then it starts to produce even more. And then you're like, but I'm using all the things they told me to use. But
Yeah.
It's one of those things when you overdo it,
Yeah.
your system is saying, hey, you're losing and you need to produce more, and that's what it does. It produces more oils, and then more oils, it clogs the pores, and then that can lead to more breakdown.
Like, here's a good analogy. You know when you go and get a pedicure, right?
Yeah.
And like back in the day, they used to use the razor.
Mm-hmm.
So your calluses would come back, like you'd have like hobbit feet after. Like they'd be so thick, right?
Right.
And you have to continue to do it. So
Right.
your body will produce stuff. If it's losing it, it'll produce it more to gain it back, right?
Right.
And it's just
Right.
matter of fact.
Right.
Trust me, man. I'm like, I used to do that all the time. That's what they taught us, and is that we had razors. Yeah. So it took me a long time to just by buffing to get it down back to normal. Awful. It's because we practiced on each other.
Every day.
Yeah.
That is very true.
It's nice to meet you.
Nice to meet you.
Take care, sweetheart.
Bye-bye.
Right.
Like you said, it produced more.
Yeah.
I had a teacher that would say the day Mac's skin only looks good on dead people.
Ooh.
Because when listen, she's European, okay?
Wow.
Let's say that.
That's funny.
Meaning no filter. So, and in a way, it's kind of true. Like our skin, we look more vibrant and more younger when our skin's like it has that natural glow to it. When we keep on trying to mattify, we look aged and kind of dried out. So in a way, I kind of understand what she meant. Maybe you're on delivery.
Yeah. Still, it's stuck in your head though.
Still stuck in my head.
So on that note, let's get personal for a minute. I'll ask you guys some personal questions.
What?
All right, so what is your personal experience with hyperpigmentation? Have either of you guys dealt with it? You mentioned you PIH after some treatments, Laura.
I used to have really bad acne, and my scar would stay for a long time, and it was really frustrating. Like burn scars, anything like so. PIH is very very prominent on me for sure. So that's my own personal experience with hyperpigmentation.
And Orica, how about yourself?
My personal experience with hyperpigmentation was at 14, 15. First moved to Canada and I got this thing called chicken pox. I had no idea what it was. And it was everywhere. And I had to start grade 9 in a new school, in a new country with dead spots all over my face. That was cute. All summer I stayed home with a sheet over my head when family friends would come over because it was rough. And one summer, I don't know, one of my cousins went camping and it wasn't warm. I don't know what it was, but it was just a bunch of spots that would came up on all of our cousins' bodies, and then they left little dark spots on my legs. So when you were sharing the stats and how hyperpigmentation makes people feel, those are one of the things I can identify with, because honestly I didn't wear shorts or skirts until like a few years ago.
Wow.
Because these marks on my legs, I think it was grade 10, I wore shorts, and this guy said you shouldn't wear shorts or skirts because your legs are damaged. And it was a wrap. Even though they were gone, I still did not wear shorts or skirts. They were long skirts or just jeans. And yeah, that was my experience. I didn't know anything about skin then. So I used all the things my aunties had, which were, Nadinola and Ambi, and we're laughing because again, they are like the staple Caribbean skincare. You can still find them in the Caribbean grocery stores. Yes, the Madenolan, they have some hydroquinone in there. It's kind of strong, and that's pretty much what I use, and it leaves outside of my face. And I was like, oh, okay, all right, and eventually they disappear. You know, when your skin is on the younger side, it goes away.
A little bit more resilient.
A little bit more resilient. So that's my personal experience with it.
Yeah. Just acne scars for me, that was bad. And so I wore makeup that was like this thick. I'll tell you that. And it made it worse because I didn't know how to clean my face properly. So right.
So our next question is, what is your current skincare regimes? We don't have to record this if you don't want, but go ahead, let's hear. What's your current skincare regime?
Oh man. To be honest, I use the Gentle Foam. That's my absolute favorite. I love it. My face has done like a full 180, like after I started using that. Even pore size, like dullness. And I do use maintenance. I use maintenance like a couple of times a week because it's strong. It's strong for me. But yeah.
Name drop the brand, please.
So the maintenance is from Simao.
Yes, it is.
So I only use that. I only use that a couple of times a week. I also use the dry skin repair from Simao, which is a great moisturizer, and I use the moist underneath for the hyaluronic acid. I also, one of my favorites is the mask, the pigment mask that we have from Beeline. I use it once a week, but I'll only put it on my skin for about 10 minutes, and when I do that, my skin is glowing. So I do it if I'm going out anywhere, it's awesome. It's one of my favorite product lines. Also jojoba. I do use jojoba because it has a smaller molecule and it can hydrate your skin as well. So.
Is that accepted? Did she pass the test?
And SPF, of course.
How about you, Rita? What's your current?
Oh wow, okay, so I go between, So, but right now, for my night routine, I use the Gentle Foam as well, and I use Ultraderm's peptide and the collagen, native collagen, like those. And I fluctuate between Sneeline Mint or no. Let's see what
Maintenance?
The female maintenance. I find female maintenance is what
strong.
So I don't use it as often.
Yeah.
I use it a couple times a week. My mornings, always vitamin C. I love my vitamin C after I cleanse. In the summertime, I just cleanse vitamin C because I get a little bit more oil in the summertime. And I do me-line day and sunscreen. I do sunscreen every day. That's pretty much it. And then sometimes I get lazy and I will just cleanse and whatever moisturizer that's sitting in front of me. One of those long days where, and I'm just being honest, it's not always the everything. Some days your skin don't need all of it. Some days your skin just need a regular, gentle moisturizer. And that's okay. You just have to know what your skin needs when it needs it. Because when you overdo things, that's when your skin starts acting out of character. Not because you have it, that doesn't mean it has to be your routine every day all day.
Switch it up. Yeah. That's the biggest thing.
Always remember, skin loves gentle with this. So when you use
So, if you guys are asking my routine, it's 3-in-1 body wash on everything.
Did you say 3-in-1?
Did you stop recording?
Oh my god.
I'm just kidding. I love the dry skin repair formula. That's my favorite. So it's a great.
Why is that your favorite?
It's a great moisturizer. Honestly, it reduces inflammation like nobody's business.
Yeah, but your ingrowns.
I had ingrowns for my beard. I was using dry skin repair for that, but even I had like eczema on my eyes and stuff around my eyelids, and it just cleared up in a day or two.
Yeah.
Really?
The Senile dry skin repair is phenomenal.
Nice.
Yeah.
Big fan of that. That's my moisturizer. So then, what do you guys? So what are some common beliefs you ascribe to or have ascribed to? So I guess as you progress as an esthetician, you kind of go through phases. What are some of the more common incorrect beliefs, I guess, you've ascribed to at some point in time in the past, you've kind of come out of? Were you always perfect in your knowledge of skincare?
Well, again, my mind's changed on ethnic skin because, again, I always heard black don't crack, right?
Yeah.
So they don't have to use SPF. So I even thought they didn't have to use SPF, right? So
Even growing up,
Yeah.
we didn't have SPF because I'm from the bushes. That was not like a thing. We didn't know anything about a physical cream that we put on our skin to protect us from the sun. But we were taught differently though. We were taught to not go outside during the peak hours of heat. If we do go outside, we were taught to wear hats. We have umbrellas, we wear long sleeves and the long pants and all of that. Even though it's a hot country, but still that's how we protected ourselves. Our grandparents, our parents, they made sure they woke up at 5 a.m. and got all the things that they needed done before a certain time. And around 4 o'clock, 3 o'clock, they come back out, and that's when we start to prepare for dinner and all of that. So when I look back at it, there was always a practice. I don't think we attributed it to sun damage or anything. I heard all sorts of different things as to why I should be out there in the sun because my hair is going to get red. You're going to look like a mongoose, and all of these things. But it was, we weren't taught that, hey, don't go in the sun because, you may get skin cancer or, you may end up with sun damage later on in life. I think they knew what they were doing, but they didn't know the reasons behind it.
They didn't know the facts, they just knew
Exactly.
the myths behind it.
Right. So, but as I got older and even getting into skincare, and actually only a few years ago I understood the reason why that even though we are afforded with a certain percentage of UV blockers in our melanin, that it wasn't enough. It wasn't enough that we need at least a minimum of 15 to protect our skin, and that we're not going to find all of that in shea butter, because that's also one of the things that I thought, hey, you wear shea butter, because that's what we hear, right? You wear shea butter and you are fine. You can backflip on the beach all you want as long as you're glazing in shea butter. So those are the little beliefs even within the culture that I had to break myself out of. And now that I know better, I teach my clients better that, hey, that's wrong. These are the reasons why your skin is uneven because of the sun damage.
So then, let's talk about your practice, for both of you guys, and your experience in clinic. So how often do you see people with hyperpigmentation in an office or even on the street?
Every day.
Every day.
Every day.
Our sun is powerful now.
Every day.
Yeah, birth control, there's so many things that
there's so many
attribute to hyperpigmentation.
And nowadays in our adult clients, a lot of adult acne.
Yeah.
And it's become such a big thing, especially for those that never experienced having acne in their earlier years, and now they're in their 30s and 40s, and now they're breaking out like crazy. And they don't know why, but there's a lot of reasons why. Our environment. society is completely different than what it was when we were younger. We're old. We're older, and we're paying bills. Most of us are in the sandwich ages as well. We're taking care of our parents. Also, relationships are declining. We're going through divorces. We're breaking up. Just stress. Everything is happening. We weren't worried about adulthood, so we're struggling. Our parents and grandparents kept all the secrets to themselves, and like, those buggers will find out. And now we're finding out, and that's in hormones.
Yeah.
Hormones is also one of the biggest factors. Again, later 30s into our 40s, perimenopausal, premenopausal, menopausal, menopause, and all of that is it's acting up. And that's what's happening. We're not sleeping. Most of our clients don't even know that they're stressed.
Nope.
I will ask them what's happening, and well, I suppose it could be this because, and when they really think about it, it's like, yeah, I've been stressed.
Yeah. They come in,
People
your
are-
shoulders are up to their ears.
Right, and like sometimes like relax.
Yeah.
Relax. It's so hard for them to do. People are paying a couple more $100 on their mortgage.
Mhm.
That's another thing. Like it's a lot of reasons behind adult acne, and they're not eating properly. If you're not sleeping, if you're stressed and depressed, you're not eating and you're not sleeping properly, you're not exercising. So acne isn't just something that pops up on the skin today. It's been happening under the surface for a while, and it just comes up. It's an awareness on that, hey, this is going on with you. So no amount of products you throw on it in that moment is going to fix it. You have to fix the gut, the mind, get your hormones checked, balanced, and all of that.
Yeah.
And because Lauren and I can do all the chemical peels and give you all the maintenance and day and nights, and it's
Try to keep it as big as much as possible, but the issue is slowly essentially if you take care of that as well. Heal from the inside out.
right.
So then on that note, what do you feel the effect is when you give somebody a long-term plan that's actually going to work to reduce anxiety, to reduce stress? Like, you play a role in it too, right? Both of you guys. When you address both clinics and individuals dealing with these problems, you're giving them a chance to be less stressed, because fundamentally stress is a desire to control something outside your control. Therefore, you to try to get your hand on something that you can't necessarily determine the outcome of.
And the skin condition in itself is stressful.
Mm-hmm.
It's stressful. Our face is like our resume. When we send our resume into a company, that's the cover letter is the first thing that they see. Our face is the first thing people see, and
That's stressful too.
and it's stressful how we show up.
I have to cancel my clients for today.
Right, it's stressful how we show up. Say we have a woman, with ingrown hairs, and it's not something that's natural to women. So you reach a certain age, and you were a prime hot girl, and then now you have hair growing on your face. That's damaging to the self-esteem and psyche and emotions and everything. And then you're picking because you've got to get rid of these things that's coming, and then you're picking. But now, wait a minute, I'm getting these scars, and now they're dark, and my skin is rough, and that's damaging. And the makeup, the amount of time spent in the morning covering all these things up, it's a whole lot. I had a client a few months ago. She was sitting in her car, and when she came in barefaced, and she was like, "You had no idea how long it took me to come in, because I really wanted to put my makeup on." And the parking lots were big. She did not want to come in with her face looking the way it did. And She didn't have to walk through a mall. She didn't have to walk through anywhere. It's hard. It's really hard for them. And imagine like our skin's dark and then you have these even darker spots. These compliments on your face. Like it's crazy. It's crazy. It's crazy.
So my next question is, how do you manage client expectations, especially with pigmentation issues?
Oh God.
Honest, just being honest.
100% honest.
And it's going to take time. How long have you had melasma on your skin for?
Right.
Give me a few months to start even chipping away at it. Right? It can take up to a year to do some real significant changes with melasma. Sometimes it will never go away. But to be honest, again, but I've seen it go away completely. And by staying on the home care, you can keep it away.
Yeah.
Right? Suppress it. Because it's got those ingredients. Right? So, yeah.
Agree. 100%
Being
honesty. Rather undersell yourself than overselling expectations. I'm very hands-on and close with them. They have my cell phone number. And I find it's easier that way. And they can get in their heads before and after pictures because they are in that mirror every day staring at themselves, so they can't see the difference. And then 2 months later, it's like, oh my God, I'm not seeing. And then you just hit them, bam! And they're like, oh.
Before and after.
Oh my God, that was my skin and this is not so. Before and after, make sure you do before and after because they will drive you crazy, feeling like it's not working, blah, 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 blah. There are some people you can't help no matter what. Someone came in a couple months ago. She said she's been to other places and nothing worked for her hyperpigmentation. And she just wanted, so I explained the service she wanted. She's like, I just want to know how it feels before I commit to the airways. That is not lying. I'm really not lying. On day 4, she messaged and there was a video on my Instagram page. It wasn't a before after video. It was just a video with women with acne and hyperpigmentation, and it's like hormones are hormoning at a high level right now. And we understand how you're feeling. We're women and blah 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 thing, and we have equipment and products that can help you. So she sent that clip. She's like, I haven't seen any changes in my skin, and I was expecting more. So it took me a couple hours because you know how we are. We see these emails and couple hours, I'm like, hi, blah blah blah. Thank you for your note. And as we paraphrase what we talked about, and what were you expecting? What were your expectations? And blah blah. So she sent the video. I was expecting like the women in your video. I checked to see when she was. 4 days. 4 days. Like, what do you think I have here that's going to give you that type of results in 4 days? So there's some people like, you know, they're in their heads a lot, and it doesn't matter what you tell them in the moment. It doesn't matter what you share with them after they've left in an email. It doesn't matter how much you reassure them. Sometimes it's okay to just like let them go because it causes more stress than anything else trying to keep them, because they've already have it in their head that, you know, this treatment should have worked one time in the first day, 2 days or whatever days, and it didn't work. So they're on to something else.
Yeah. You have to keep your own standards as well.
Right.
You know? Right. Yeah. Because that can hurt. It can hurt your feelings. You know, you're doing everything for this person, and then still it's not good enough. So
Right.
I learned that the hard way, obviously.
Yeah, especially when we have TikTok and every social media, they see before, after. That's why when I post before and after, it's a story.
Yeah.
off when the person came in and they showed a transformation between. So I don't just say, oh, before and after. Look at my client. She's glowing and she's this and this and this and that. I tell a story, so there's no way you can sit there and think that that person got to where he or she got in a month. It's this, if I would say, between January to whatever. So they understand that, hey, it took a little bit of time for that person to get to where they are. So I tell a story.
Absolutely. So then, what are your choice modalities for hyperpigmentation? Like, does it vary by condition? So, like, whether you use laser, whether you use our products, you better say our products.
I'm going to. Give me a minute.
And does it vary by condition? So let's say, for example, PIH versus if you have dark circles or if you have other different types of pigmentation.
Yeah.
How do you vary that up?
So for me, to be honest, for melasma, I always pair microneedling with ID with our appeals, or ethnic or Caucasian, or actually even CML as well. So that's how I do it. I also have seen amazing results with airways. That's my absolute favorite. And I just found out recently that you can do it in the same day, which is even more amazing. So,
Yeah,
that's fun.
Orica, how about yourself?
So for acne, I love microneedling and IV. And I have my little tricks that I do with other stuff on top of the microneedling. You can spot treat the darker spot areas with some chemical peel to make it a little bit faster. Melasma, I think you know what I'm going to say, it's airways and either V-line or CMO. I love airways for the fact that it works on the dermal level. Works on the dermal level, and then the chemical peel also. I do a prep with day and night for a month. They go on for 3 weeks. So I prep them for 3 weeks. They stay off for a week, and then they come in. We do the airways. I cool the skin down, and then I put, if I want them out fast, I'll do V-line, and or we'll do if I have room, then they will hang out in one room while they have the CMO on, and then somebody else in there. That and PIH, anything goes.
Yeah.
Between V-line, CMO, or and laser.
Yeah.
But I love the laser and CMO V-line combo. It gets them out faster.
Faster results, yeah.
Faster results, and it's better for them in their mental health. Yeah, my mental health.
So just to describe that mechanism, just to kind of elucidate that a bit, because it's not necessarily in the presentation, but I think it's worth understanding why that combination of laser plus a suppression like protocol like Milan or CML works so well. Because with the laser, you're essentially fractionating the melanin itself. You're creating it in a position now where it's available to be resorbed and be removed from the skin. In addition to that, now you're providing the products which help to help the underlying processes to be effective as well. So production melanin is now effective. So you're not only removing what's present, especially in the dermis, the dermal tract melasma, you're also getting rid of the actual process producing it. So you're doing both together at the same time. Versus if you did it simply with a peel or simply with a laser, it would be half the job done either way. So it's a really amazing combination if you can do it right. Again, it's worth noting that it's got to be something you do with proper education and with proper considerations for each client as well. So I guess the next question for you is, let's get that one. What's the importance of home care in maintaining results, regardless of the modality used?
It's extremely important. And right off the bat, I tell clients that if you don't have a home care, then you're wasting your money. You're wasting your money. You're really chasing your tail. And if you, whatever your politics is on sunscreen, you kind of have to change. because again, you're wasting your money. If you're not protecting your skin, then whatever you do in here doesn't really matter, because then you're going to go back outside and it's going to reverse what you did. So sunscreen is extremely important, and when you have I guess anyone, because I think people still don't understand how to use sunscreen. People will use a pea size. So my main job in here is literally teaching people how to use products, especially sunscreen. Like, this is not communion. This is a whole meal on both fingers, and you apply it down to your chest and into your ears, and then you reapply every 2 hours, and then like that much sunscreen. Yes, that much sunscreen every 2 hours. Yes, but then what if I wear makeup? And then, I go in, well, they have the aerosol, you can spray, or, they have them in powder form, and they're like, okay. So I think it worked, although one person was burnt with hook this summer. Where was your sunscreen? She put that sunscreen, it was in my bag. So a lot of people are getting it because it's now, the education is now circulating, thank God for internet, and on TikTok and everything else. So it's there and it's in their face. So we have the help of that.
Yeah.
But,
those, good and bad.
Yeah, and just also teaching them that, once you get the results from, like, say, Newline or CML, it's not really a good idea to stop and go back to what you were using, because what you were using obviously wasn't working.
Yeah.
It wasn't working. So what makes you think that you can go back to using the thing that wasn't working? So just try to cement the importance of maintaining with the products that you use to get the results.
Absolutely. So then, how often do you guys also see adverse events generally in practice and side effects when treating skin of color? And which ones are the most common that you see?
Well, because I'm a salesperson, I see adverse events a lot, actually. People still don't understand that with chemical peels, you're control burning somebody's skin. Mm-hmm. So skipping steps or leaving it on longer than you should just because they want their client to have better results, it's big mistakes that I see all the time. So I see not really burns, but a lot of PIH, or post-inflammatory hyperpigmentation afterwards. Thank goodness the home care takes care of that. So thank God, but that's what I see a lot.
Honestly, in my first few months of using Newline, we talked about that in my prototype 6. I had 2 prototype 6 clients. It was amazing, but then they had adverse effects like hyperpigmentation. It went away, but it wasn't something that they wanted to see. Like, here I am trying to get rid of my dark spots, and then now I'm even darker. Like, what the hell, this girl doesn't know what she's doing. So I actually stayed away from Newline for a while because of that reason, and then I was retrained on it, and then came CML that I fell in love with, because CML doesn't do that at all. But I see issues ever so often from other people, whether it's from laser burn, chemical peel burns, or something crazy, or even them burning themselves with cool sculpting that they purchased from somewhere, acne something.
Yeah.
So we see Amazon peels. This person burnt their face off with desert from Amazon. So we see a lot of that. And again, education. We feel like whatever we see out there that's for sale, that's open to us, that we can purchase it and use it, because I don't want to pay you guys to do this when I can do it at home and save money, and then they can turn to us. Yeah. We see.
We're righting a lot of wrongs.
Yeah, so them doing it to themselves and other professionals doing it to them.
Yeah. Trying to cut corners.
Right.
Exactly. So the last question I have for you guys is this. How do you feel, given all we've discussed today, how do you best address the issues raised regarding the care of people of color?
Education. Education and getting it out there and, doing more events like this, like spreading the word.
Yeah, definitely more events like this to educate estheticians, nurses, doctors, and so we can educate our clients. Because we can't educate our clients if we don't have the knowledge ourselves, right? Because what I get a lot from here is I used to go somewhere else and I still don't know what they put on my skin. It's like I get a facial, I don't know what they did. I get products, I'm sold a lot of products for a lot of money and I don't know what they do. And my skin feels dry or I went and I got bruised. And it's a lot of stories. So seminars like this is really important because sometimes we do get a little bit cocky. Well, I've been doing this for many years. You can't tell me anything. I know everything. In actuality, your education was 15, 20, 30 years ago. A lot of things have changed. Products, companies have changed a lot, and they do a lot of things like Derma Beauty, and there's so much to learn. So 100% education.
Okay. Well, that's it for the questions for right now. We have one more thing left. Lauren's just going to go through some of the products, explain a bit of the science behind those, and then we're all done after that. So,
A little word and everything after this. Okay.
that was lunch. Anyway, so Mila and Simel, these are the two brands we represent here at Derma Beauty Inc. And so we're going to kind of go through both of those step by step, and Lauren will do most of the talking. I'm here to answer questions and support on the science side as well. So, Mila, get it up.
Okay, so the packaging of Meline, the reason why we have different colors is just for professional and for home use. So for professional, the 00 is the skin preparation, the 01 is the skin brightening, the 02 is post-brightening care, the 03 is recovery, and the 04, the 05 is skin replenishment and protection, but the 05 is also the mask as well. So that actually has all of the acids in it, and it can be pretty strong, but it's absolutely amazing. So when you're working with your clients, if they have more sensitive skin, you just cut down the time that they're using the mask, which is it.
Exactly. Yeah, so just to make that very clear, there's two portions to all Meline treatments, either the in-office professional side, which you can see is a smaller portion, and the majority of the work really is done at home. That's the main focus with us. It's not necessarily about the peel itself. In fact, in some cases, you can even skip the peel, but the home care will do the majority of the work. So in the case of Meline ID, which is our intradermal / microneedling product, you're basically putting on the face, microneedling to a depth of about 0.5 mils. And in doing so and following the home care, you're getting all the effects without the peel itself. So those are options for that. So the peel is really secondary to the home care. That's the key thing with our products.
Mm. So I always say like 80-20, like 80 is the home care and 20 is in clinic. So this is kind of the protocol here. It's really straightforward. It's so easy to use, and our protocol booklets pretty much help you all the way through. Start with your gentle foam, you cleanse the skin, then you use the prep for 3 minutes. You're always talking to your client as well. How's it feeling on your skin? You're looking for frosting. If it's frosting more than 25% of the face, I usually say use cold compresses just to calm down the skin. And then you can still continue with the rest of the process, okay? So same thing as like the aerolase laser, she was saying, you have to have that cool down time if there's a lot of reaction. You use the 01, which is the peel. Then you use it the first one for 15 minutes, the first layer, and then the second one for 15 minutes as well. Yeah, and then you cleanse the skin, and then you follow up with the moist afterwards. And then if they're going out into the sun, I usually do apply an SPF.
Absolutely. And so just to kind of clarify a bit about the product, so with the prep itself, it's kind of like a pre-exfoliant, if you will. So it does contain lactic acid and other exfoliant agents to really get the whole process started. When you follow up with the 01 ethnic skin, that's kind of your peel, plus also a lot of depigmentation in that first session. So the 00 prep has none of that, has no depigmenting at all. Just literally, it's getting that first layer of skin ready to go. In addition to having cleansed it with the foam, you're putting on the ethnic skin to begin depigmentation. So it has tranexamic acid, it has kojic acid, a bunch of great stuff to begin the process with ethnic skin, including mandelic acid. So for ethnic skin, mandelic is the bomb. It absorbs super deep. So it absorbs super deep into the skin. It's a nice, gentle effect of exfoliation versus, let's say, azelaic was just basically a surface burn.
Yeah.
So that's the difference there. And then, like we talked.
Caucasian.
And if you want to get a better, stronger effect with the peel, the key isn't to rub it in or apply more of it. It's to leave it on for a bit longer. You can go up to 45 minutes with that first peel if you want to. But again, you're doing so to extend the time of the presence of this one, the 01 ethnic, rather than, let's say, the prep. So don't double up the prep. Don't go crazy on that. Focus on the ethnic as your main treatment option.
Also, you have to make sure that if you do have a client that is sensitive or phototypes 4, 5, or 6, I always suggest pre-peel prep. So doing the home care beforehand for at least 4 weeks, at least that.
And then would you stop the home care before the
yes.
actual peel? Yeah.
So for the week before they're coming in, you stop all of the acids. So you'd still be using your moisturizer and your SPF. And making sure that you drink lots of water, like we talked about earlier, and try to minimize the alcohol intake as well, because that dries out the skin.
We don't put that in the presentation for a reason.
Yeah, well, it's true though. You have to.
So there's some before and after. So Lauren, you walk us through those.
Yeah. So this is just some results that we have collected. This is obviously a gentleman, and he's got the sun damage here, and then that's the after picture. Obviously.
And what you'll notice
some
is.
erythema.
Yeah, what you notice, which is interesting, it looks like 2 different people for a reason, because the skin tone's actually changed. That's a really interesting part with our products. It actually changes your skin tone as you use it because it's regulating your melanin production. So essentially, what you'll find is the color you have on your neck and your chest becomes the color on your face because you're undoing all that sun damage, all the UV damage. You're letting your body go back to its natural production. That's why you don't ever really see any. Yeah.
Can we say something for that?
Sure.
Especially with your darker skin tone, it can be scary for them. Because they haven't seen their face in its natural state in such a very long time.
Yeah.
It may look like to them, it may feel as if it's bleaching.
Yeah.
So remember we were talking about bleaching in our community and how it is. So there's this big stigma. They don't want to look like they're bleaching. So I find like the me line, like there's like a lot of education that goes into it. You have to walk them through the steps of what they will see and that. Hey, it's going to start. You're not bleaching. It's just that you haven't seen your skin tone in so long because of the sun damage, and now it's just changing to the rest of your body. You're
Exactly.
You're not bleaching. You don't look like a different person, and all of that.
Yeah, it's true. That's the key thing is even skin tone, right? That's the goal.
Again, just some more before and afters here. Okay, so the dark circles. Have you tried it before? Yeah? No, not yet. Who uses the dark circles? Anybody?
I haven't used it on myself, but I use it on clients.
Oh, okay, great. Not only is dark circles good for dark circles, but it also helps with maintaining anti-aging around the eyes as well. This is a little bit more of a complicated protocol. We do, require going in and showing. I like that the best. We do also have a video. But again, you're just cleansing the skin around the eyes and making sure that you don't use too much gentle foam because you don't want to irritate. But it is safe to use around the eyes. You would use a syringe to take about, I always say 0.2 to 0.5, it depends, but I take less. Less is more because you don't want to waste the product, right? So you can always keep extracting from the vial as well. And then you're just doing 2 passes on the eyes with the first step, and then the second step, same thing, 2 passes. You're also leaving that on for 15 minutes. You're just going all the way through. You're not stopping in between. You're just going right across. And then after that, you would use the gentle foam again with water but you're going to make sure that you always like wring out the gauze while you're doing it and just pressing it. Okay, so if you start rubbing, it's going to be really irritating for the client. And then you finish off with moist. Now, I usually don't typically put sunscreen around the area just because it can be a little bit irritating, but I kind of do go around just a bit to make sure that they're protected as well.
Yeah, and one of the really cool things with this formulation is it's very different than most of the other dark circle products in the market. Most of them focus on what is statistically the most common cause, which is vasodilation that leads to dark circles. Our product does two things. Yes, it controls vasodilation, so we have a lot of natural herbal ingredients in there that help constrict the blood vessels, even in the home care and the in-clinic peel in step 2. But also in step 1, we have an actual depigmenting and peeling agent as well. So we're actually fixing the pigment and peeling plus constricting vessels. It's a huge change compared to every other brand in the market. Right now, as far as we can tell, no one else is doing that. That's why results are really mind-blowing, because you see the puffiness goes down, the color changes, and the old skin peels off. So it's one of the only really safe peels around the eyes.
It's essential to use the home care for that reason as well, because it does.
Yeah. It's like there's before and after.
Yeah, it's wild. I mean, you can tell the skin, it's like lighter, but still really nice.
Can you remind us how many times you apply it?
So usually I would say a minimum of 3 treatments. A lot of my clients do about 4 to 5, and you're doing it in a 3-week span. So you're doing every 3 weeks, and then you're doing the home care in between. And before they come in, they're off for 5 days of their home care as well.
Yeah, you can see there even the color and tone around the eyes, as well as the puffiness has gone down just in a matter of 2 sessions. So.
I've seen lots of success with that. Okay, this is my favorite, the Intimate. Again, anybody uses Intimate? Do you use Intimate?
Not on myself.
On clients, yeah. Oh my goodness, this is absolutely.
That under on.
Yeah. Yeah. This is a great thing to put into your practice at clinic. You can, the revenue is fantastic from this, to be honest. It's an instant gratification. With one peel, you can see the difference. There is home care as well, which is pretty important, and it's an easy process. You cleanse the skin, and then literally you break the ampoule and put it in a bowl, and you'll leave it on the skin for 10 minutes. Okay, but you're also leaving it on the skin. You're not washing it off. You're going to apply the moist right over top, and you're going to go home with it, and then wash it off 8 to 10 hours later.
Have a fan going.
Have a fan going, yes, for sure. Yes.
Spicy.
Again, if you do see frosting, you make sure you put cold compresses on it. Okay. 9 times out of 10, it will frost. If it's more than 25% of the area, then again, cold compresses. But it works fantastic.
Now, the really interesting thing about the formulation of this is it's very similar to our ethnic peel. The reason why, what's interesting is the presence of mandelic acid and the antioxidants present in both give you a sense of how sensitive really ethnic skin is compared to other types, right? So our ethnic peels have literally almost the same formulation for that reason. It's a very sensitive area. If you're really careful, you have to really focus on antioxidants, anti-inflammation in that area. And so you can see some of the results are really mind-blowing. Like before and after, this is like about a month and a half, 2 months afterwards, right? So you can see even around the inner thighs where the chafing is, where all that friction would be, the results are just incredible before and after. So Lauren?
Yeah, so moist. This is your hyaluronic acid, and this also has allantoin and panthenol. I always say, is it allantoin? I always say it. Okay. That's your tissue repair as well. It is a must when you're doing chemical peels. The reason why is because it acts as an occlusive barrier. It keeps the bad bacteria out and the good in. Okay, so this is essential for repairing the skin and making sure you're staying hydrated. This is my favorite. I was already talking about it. The pigment mask. You can use it once a week. You can use it again for just like a quick glow, if you will, or you can leave it on the skin for 45 minutes and you're assessing your client to see how sensitive they are. It has all of the acids: mandelic, azelaic, has tranexamic acid. It is strong, but it's amazing product.
The key place where it's going to be used is in maintenance. So once you've done your set of peels and someone's in that long-term maintenance phase, this is gold, because every couple of weeks you use this, it essentially resets the effect of the peel.
Yeah.
So you have to keep coming in for peels. So for you as a clinic, if you want to keep somebody on, let's say, a lower cost maintenance plan, this is how I would do it. rather than coming back in for a peel every 3-4 months.
Yeah, at home peel.
Exactly. Yeah. And then here's your boy.
ID. So ID is done with microneedling. Again, how I do it is with sandwiching in between the superficial peels. So ethnic, Caucasian, or CML. It gets into the dermal layer where, again, if you have melasma that's sitting on your skin for over 3 years, it gets into the dermis. So this helps to get the drug in and then do its job. It's got glutathione in it, it's got niacinamide, it's got ascorbic acid and tranexamic acid, all of the acids you need to help brighten the skin.
Absolutely.
Glutathione is something actually found in, do you know about glutathione? No? Yeah, it's amazing. It's actually found in your skin. Yeah, exactly. So it's adding to it, which is great because you lose your glutathione every year that you get over it. I even actually take it orally as well. Yeah, I take it orally in a drink. Yeah, it's really cool.
Yeah. You can do it in IV. You could also do it as inhalation, like for people with lung problems. It's phenomenal. Like
Oh, really?
Someone to do that.
I do it.
She'll do it. She'll do it. She's telling me she's worried about like if I'm not going to use COPD.
Really?
I have a buffer in there.
I mean, listen, you have to do it at the right concentration, and you have to have the proper diffuser, so you have to do it all correctly. So you have to have a proper machine that gives you the right concentrations. If you take too much at once, you can have problems, right? So it has to be a slow, long process. Yeah. But it works. Yeah. So then for ID, like we mentioned, it has deeper penetration, minimal allergens. Again, glutathione is the one thing that might be an allergen to some people, with a sulfite allergy, but it's extremely rare, especially on the skin. So the really cool thing, like Lauren was mentioning, it targets the dermal pigmentation. By hitting right there at the 0.5, you're right there. So people often say, well, I need to do something specific for dermal pigmentation. But the reason it happens, if you look at the biochemistry and the science behind how dermal pigmentation happens, is what's sitting in the basal layer breaks through a broken basal membrane into the dermis. That's how it gets there. So the basal membrane is open and broken. Well then, everything you apply will be absorbed to some degree. So there's always going to be some effect on dermal melasma with any peel you put on. But to improve your results, you need to use either laser or use in combination with ID as well to get that full effect. So it's not that your peel won't do anything, because it will help with dermal melasma, and you can potentially fix it over a long, long period of time. But for quicker, accelerated results, this and laser are the way to go.
Yeah, exactly.
So this one is just with
Microneedling.
Microneedling
Yes.
Yes,
That's
yeah. Yeah, it's the solution that you use with
Home
and
care.
then the home care would be either the ethnic or the Caucasian.
Yeah. So based on your skin analysis, you pick what the best option for them is. If we see dermal melasma, this is probably the best option from our offerings.
Yeah. Also, if you have clients that don't want to peel, but they want the same effects, you can do the microneedling with the ID. And it'll take probably about 6 treatments, but it'll still work like that.
Yeah. So we mentioned you have a singular therapy versus a combination therapy with our peels, or even other modalities. You can use it in that way. So where you do 1 week with the microneedling, and then 2 weeks later, you do the peel and vice versa, and you switch back and forth.
Yeah.
And so that way you don't need home care in that period of time, just moisturizing SPF. When you hit the maintenance phase, you add the home care back in.
Yeah, you can do it that way as well, or you can space it out even like to 3 weeks, so they are using their home care that's using all of the treatments.
That's why you need a rep like her to talk to her. That's it.
So what size pen do you usually recommend? I know you're going with 0.5,
Yeah.
but is it like 11 needles, 16?
I usually do 12. I think it's 12 needles. Is it 12? 6 and 12. It doesn't really matter. You're just like because you're doing 2 passes.
Area.
Yeah. Yeah. You can do the whole face as well if you like. Yeah. Yeah.
You can do it.
You can.
That's the cool thing with that, versus even with the peels as well. Like with the peels, our protocols show you do 1 full pass with the peel, but then you do a second targeted pass afterwards. So you don't need to buy a spot treatment. It's all part of the combined protocol, right? So
the higher the needles, I mean, like the less passes I would go, to be honest, because you don't want to cause too much inflammation as well.
Exactly.
Right?
That's the one thing I'd say. Like you have to be sure to use a proper numbing cream and know their sensitivity beforehand. So if it's their first time doing microneedling and their skin is dry as heavens, they haven't drank water in a week and a half, be a bit careful with those.
Yes.
Yes, always. Always.
Exactly. Oh, okay, good. Yeah, exactly. Yeah, for sure. That's always why I just say, just make sure you're covering no
Because
matter
that
what.
hyperpigmentation
Can happen a lot, yeah, especially if they go too deep, right?
Yeah.
Yeah, so this is just kind of a chart of all of our ingredients. We have ascorbic acid, azelaic, it just shows what's in what. So Caucasian, we use the azelaic. Ethnic, we use mandelic. Hyaluronic acid is obviously in a lot of our products. Kojic acid is a great brightening. Lactic, again, this is tranexamic acid is pretty much in everything except for I think a couple like
Night creams, yeah.
Yeah.
And Simel. System before and after.
Yeah.
This is with the facial protocol on the course of about 2.5 months for all these guys. So it's 3 sessions usually is our standard before and after time.
These
so
are the full protocols, right?
Yeah. So, and then this is one of your clients, right?
Yeah. Asian skin is particularly hard to treat because they can get irritation really, really easily.
No, I said once you figure out Asian skin, you figure out brown skin,
Yeah.
everybody else's
100%. So again, it's a good way of like just prep, re-prep. So the ingredients are plant-based. Don't be fooled by plant-based because it's still strong.
Oh, yeah.
Some people get that confused. We have the Amblica. I'm not going to bother with that one. So the Amblica is your brightening. It's a great antioxidant and vitamin C. Again, it takes care of the cascade of melanin production. It's copper chelation. So, have anybody heard of copper chelation before? So it literally takes the 2 molecules apart, so the melanin doesn't produce. So again, you're hitting it on every single level. The alpha-arbutin is another brightening. Retinol, obviously, helps with cell turnover. And arnica is for healing and calming the skin, which is such a beautiful ingredient that we have in our products.
Absolutely. You want to go through all the science, or
You can go ahead.
I'll skip through that. That's okay.
This is, we all like that.
Here's all our studies and research. It's late in the afternoon. We love you guys, so we'll spare you on this one.
Everybody knows what retinol is.
Yeah. But arnica, I'll say specifically, is one of the most interesting ingredients you probably never used or heard of in the cosmetic field. As a naturopath, it's my bread and butter, right? So if I have a sprained ankle, I'm putting this on immediately because what it does increases blood flow and improves healing of anything it touches. So imagine the effects then when you put that into your recovery cream on the skin. So you're basically improving blood flow, concentration of all your anti-inflammatory markers in your body naturally. You're putting it all in one place to improve the quality of skin. So our recovery cream, dry skin repair, in my opinion, can be used with any protocol we have.
Laser and which one? Dry skin repair.
Yeah, we'll look at those in a second. So
the smell activator is our peel. Again, it's so versatile. You can use it anywhere on the body. I would kind of steer clear of using it on the intimate parts. It can be a little bit sensitive for 5s and 6s, but you can use it on phototypes 1 to 4. You just have to cut down the time that you're using it on, and that's something that we can talk about for sure. It's got the alpha-arbutin and Amblica, it's got kojic acid, and also has salicylic acid, so it's great for somebody who has like minor breakouts. I'll show you some before and afters from my client actually. She had like a breakout from going to the gym, and she did the peel. The next day, it was almost gone, which is wild. I've never seen that before in my life, but even with using salicylic pure, it's just the combination of the ingredients. Yeah.
Like to make it very clear, the difference between Meline and Simel fundamentally is in the approach to skin. So Meline is really a targeted melasma treatment, whereas Simel is also that plus on top of it, it's an anti-inflammatory, anti-sebum kind of formulation where basically you're breaking down sebum to nothing, reducing inflammation and redness, and you're targeting the pigmentation with one ingredient, which is Amblica primarily. And then you have the kojic acid, other ones, where it's their secondary function. They're primarily antioxidant acids, but also helping with pigment, whereas the big dog is your Amblica, and everything else has either an antioxidant or anti-inflammatory function, as well as brightening. So the formulation with Simel really is for someone with redness, inflammation, acne, and pigmentation. That's really what it's able to do that other brands just can't. And so that's why we're really a fan of it. It's also a simpler protocol because it's only 4 products. Versus Meline where it is a lot more complex. So depending on your style of practice and the type of clients you have, Both brands can work really well for you. It's just knowing what's best for you.
Mhm.
Some of them want a cheaper, more hardcore option. That's like the peeling is intense with Simel. Like we call it snake skin, is what we call it. It comes off your face.
Yeah.
So versus Meline, where it's a more of a gentle microexfoliation. Primarily, you can get full-on peeling, but it's not always guaranteed.
It
That's
just
the key.
depends on
Yeah.
the client as well.
Yeah.
I think he has young as like 18, 16.
18 is nothing before that. Yeah.
Yeah.
Just because the retinol, right?
Yes, especially with the activator.
Yeah.
Yeah, just general breakdown of the ingredients there. So 3% retinol, you want to be careful with that for
Yes.
sure. And
Yeah, and salicylic. Glyceriteric. How do you say that?
glycertinic.
But
It's the one it's from licorice root, right?
yeah,
So,
it's a great antioxidant.
Yes, it is. Yes, licorice root in general is a great ingredient if you use it for like blood pressure and heart stuff. If it's deglycerinated, because the glycerin part is actually really bad for your heart if you take it consistently. It increases blood pressure. So it's a really strong antioxidant, but it also has that side effect when consumed. So be aware of that. With maintenance.
Yes. I absolutely love maintenance. I've seen so many great results. Again, it's very strong. You can treat your clients in many different ways with maintenance. You can do the pre-peel, and sometimes they don't even need the actual peel. They can just keep using the maintenance. If you're getting good results with that, I would just stick with that, the maintenance as well.
Yeah, because this product is very complex. And we'll look at the ingredients for all of them in one picture, a really cool picture at the end, to show you really the complexity of our ingredients. But essentially what it is a night cream that does it all. So with Meline, the day cream and night cream do separate things. The day cream does more depigmentation, and the night cream does more the breakdown at night, because again, if you're breaking down exfoliating at night, that's when you're not exposed to UV light. Right? So this one is a combo of both. So it does depigmentation plus the peeling at night once, and that's it. So again, one less product and very strong effects.
Your vitamin C's and retinols.
Dry skin repair?
The dry skin repair. So this is, again, what we were talking about before. You can use it after laser treatments, after pretty much any treatment that you can think of in the office and clinic. It's got the Orica, which really helps to calm and soothe the skin. It's got the phytic acid that will also help with cell turnover and cell repair. And it's got your shea butter as well.
And then the outdoor hydrator?
Yeah, the outdoor hydrator. I know this is Orica's favorite.
I absolutely love it, and it's really hydrating.
Yes.
It's not. It doesn't leave that shine. Make you feel that shine that everybody's running away from, that greasy feeling.
Yeah.
And it has some shea butter in there as well, so it doesn't leave the skin with a film.
Yeah.
That's right. That's the key thing.
Yes,
So
exactly.
that's important to your regular skin clientele. So
It doesn't leave you with that ashy.
No,
Yeah.
no.
not at all.
Which is great.
And you don't have to work. I find I don't have to work to
It goes
pour
right
it
in.
either.
Yeah.
It just goes on.
Yeah, exactly.
Like even compared to the BB cream, the BB cream is a nightmare to work in for the medium sometimes. It can be, because it takes...
I really hate
it
for
takes
myself. I don't know what
Well, that's what I was saying.
I
Yeah,
hate
so.
anything with a tint in it.
Yeah.
It's
Yeah.
difficult.
It's like foundation.
Yes, exactly.
They'll have medium and something that looks like my skin tone, and then I'm gonna put it on my face.
Yeah, no, exactly. Titanium dioxide and zinc.
Yeah.
I think, zinc is what makes it. Really
Whereas with this one, it's unpigmented, so it's like literally goes on smooth like it would like a regular cream, to the point where you're like, did I actually put on sunscreen?
Yeah.
That's the thing.
Right.
Right?
Right.
Yeah.
It's very confusing in a sense, because you're used to a much thicker, nastier, rub it on your face, your zinc white face. This is really a much
And
simpler
it
thing.
smells good.
Yeah.
So this is
Sunscreen.
this is the sunscreen.
So,
yeah, exactly.
Stats on it, it's SPF 50 plus. It's broad spectrum UVA, UVB, invisible light. It's got 5 chemical sunscreens and 2 physical sunscreens built into it. So it's really like, when we're talking like full coverage, this is what it is.
I know
this is-
people have like problems with chemical sunscreen, but there's nothing in there that causes
No.
cancer. It's I would rather use a chemical sunscreen on my face than get skin cancer. So you know what I mean?
So,
Like you have to
What-
weigh the
when you're guaranteeing SPF 50 plus coverage,
yeah.
plus you have the physical barriers too,
Exactly.
you're doing both. And so in combination with the other products,
Yeah.
because of where it's applied, so when you apply your products with us, we give you a list of how to do it. So generally your first step is a dry skin repair. which is your recovery cream and everything else. We encourage the use of the moisturizer on top, which is a hyaluronic-based one on top of that. And then on top of that, you put on your sunscreen, right? So you have the sunscreen sitting on top of a layer of an occlusive layer of hyaluronic acid. Underneath that is your recovery cream, which needs to be absorbed. So your sunscreen sits on top of all that. So the absorption rate is actually much lower for that reason. And so we're doing that on purpose, give you optimal protection, but also give you a layer of protection from any absorption, even though the ingredients statistically, there's nothing wrong with them either. They're all, in Europe, they're all approved for multi-use, but just in case, we don't want to get any extra chemical burden in your body. So that's why we design our formulations and our protocols that way.
Yeah.
Okay. And so then, what more?
Oh, the Illume.
It looks similar.
It looks like the Okay, so the Illume is your intimate cream. Okay, you can use it underneath your arms. You can use it on your bikini area. Now you can just use this on its own. You don't necessarily have to get a chemical peel for this to work. It will take a little bit longer, but this is a great product for anything. Like if you're doing laser treatments, right, and you obviously know that there could be some pigmentation afterwards, just pairing that with it is absolutely fantastic.
Yeah, exactly.
Yeah, again, it has the licorice root. I think this one's got a gluten in it as well.
Go to all of them.
Yeah.
Here's the big list on this next side. There's everything. Yeah.
It's kind of hard to tell, but.
I know. Well, it's solid, honestly.
No, it's hard to see. Just
yeah. Sorry, it has the arbutin, the phenanthium, and it has glycolic acid as well.
Yeah.
So the cool thing with that one with the Illume is that it can be used as a home care option for intimate areas. Most people don't want to have to go home with a garbage product they bought off the store for their intimate areas, or come in sometimes to get their intimate areas treated by an esthetician. This is a great option for them. So, like in the Middle East particularly, this product does gangbusters because there's a more conservative culture there. People don't want everyone touching and playing with their body parts. Like, listen, give me something for home. I'll take it home with my dry skin repair, and we're good to go. And so, so it's good to. So what? Yes. Yeah. So what we say generally, like when we approach the sale of both these products, I recommend if you're a clinic, look at both of them as options that are equivalent. So you price them the same, regardless of what they choose. If they want to have a proper in-clinic treatment done with the Meline Intimate, do it. But for the same price, you're taking the home care.
Yeah.
Because it is clinical, it is a high level effect, but it's going to be something you do at home. To give them a price option that's different between the two, gives them the opportunity to take the cheap way out and not get the proper assessment and treatment done. So you don't want that to happen either. So both options should be priced similarly. In terms of ingredients, you can see a couple more here that we didn't mention earlier. So if you look on the left side there, cypress extract, Solomon's seal, and butcher's broom are three of my favorites. These are extracts you find in nature that are meant primarily to reduce inflammation, to improve healthy skin, and to tighten the skin as well. So you're going to come out of the peel with more healthy, less dry skin, which is phenomenal after a peel. The one peel I'd say that you ever see that actually leaves your skin more moist would be the Simel dress.
Yeah, 100%.
That's really cool. Yeah, it's crazy. Like, I've seen people, like, Lucy, you can give your testimony if you want to. Like, the experience with the Simel peel, like, your skin was not dry afterwards at all. You came back to work the next day.
Yeah. When I did it, the thing that I noticed is my skin was like brightening. Yeah. It wasn't dry. Yeah. Like it was.
It's smooth. Yeah.
No.
Exactly.
Still going.
It never stops. Yeah. So yeah, all this being said, if you want to try these products, learn more about them, you have Lauren Sharpe right here, who's our top salesperson, number one. So give her an email, give her a shout, or you can talk to her right now, get some more information, or you can check our website, dermabeautyinc.com. And on socials, we're at Derma Beauty Inc. And for the show today, anybody who wants to make an order in the next couple of weeks, you have a special promotion here using this promo code SETTING23, get an extra 8% off your next order above $2,500 or 10% off above $5,000, and you get a free outdoor hydrator with your next purchase on us. We want to thank you all for being here today. We really do. It's been a great time. And any closing thoughts or questions from you guys? No, the sun's setting.
Covered a lot today.
The sun's setting. It's been an awesome time. Thank you guys for your time.
Thank you.
Thank you.
Thank you so much.
Bye.